I'm J.Crayton Pruitt Jr. I'm a cardiothoracic surgeon at St. Joseph's Hospital in Tampa, Florida. A valve problem typically would mean that the valve is either leaking or is narrowed. The valve is like a door letting the blood go from one room to another room, and then the door is meant to shut to prevent it from going backwards. These valves are typically very thin, soft tissue that in disease states becomes thickened and calcified and quits opening properly or doesn't shut properly so that it leaks. Well, very often it's a tendency to fatigue easily or to have shortness of breath with exertion predominantly. Later you might develop swelling of the ankles, or then the rhythm disturbances tend to follow as the heart stretches. The heart actually begins to enlarge due to the inefficiencies of having leaking valves or dysfunctional valves. Generally, the further down the path you get as things progress, the heart gets larger and larger, the repairs tend to become more complicated, and risks of surgery typically a little higher. What we like to have at St. Joe's, and what we do have, is a program where patients are followed closely by their primary care doctors, and then when symptoms begin to arise, or even before, maybe subtle signs on examination, then tests are performed that get us an early clue that these things might be starting to happen. We are doing minimally invasive valve surgery. It's a procedure that does take a little longer to perform, but with proper equipment and experience, excellent results are being achieved.